ओके।
गुड मॉर्निंग एवरीवन। जैसे हमने कल अनाउंस करा था कि डेयर का हमारा एनिवर्सरी मंथ चल रहा है और ये पूरा महीना हम डेयर पे सीनियर डॉक्टर्स के जूम सेशंस ऑपरेट करवाने वाले हैं और हमें उम्मीद भी है कि आप लोग एंजॉय भी करेंगे और ये आपको लगेगा आप कुछ नया लर्न भी कर पाएंगे हमारे सीनियर से। ठीक है जी, तो मिस मत कीजिएगा हमारे सेशंस को। वैसे लाइव भी ये चलता है और साथ में हमारे यूट्यूब पर भी ये इनकी रिकॉर्डिंग्स आपको मिलती रहेगी। तो आज मेरे ही मेंटर हैं डॉक्टर रविंद्र कोछड़। जो भी मैं आज हूँ सर की वजह से, सर ने पढ़ाया लिखाया बढ़ाया, जो अंडरस्टैंडिंग सर ने मुझे दी आज मैं उन्हीं को आगे बढ़ा रही हूँ। और सर हमारे डेयर के पैटर्न भी हैं, सर हमारे डेयर की बैकबोन भी हैं और मेरे आइडियल भी हैं। तो वेलकम सर।
Yes. Hello.
हाँ जी सर, वेलकम जी।
So, welcome to all the member of this society. So, today we are starting a new lecture, role of homeopathy in surgical disease. Basically, we have learned so many things about the surgical disease. Everybody knows this thing, what is a surgical disease. But this surgical disease are two type of the disease. Basically, homeopathically we consider one is a true surgical disease and other is a false surgical disease. The true surgical disease where we cannot do anything, that cannot be treated with any medicine, that cannot only the surgery can intervene or remove the organ or vista or change the organ or vista or replace the organ or vista. Whereas in case of false surgical disease, we have seen this thing that can be treated with the help of medicine also, that can be treated with the help of surgery also. So this type of disease to whom Hahnemann says basically so-called surgical disease. So these type of diseases, we are now indeed, we have seen this thing that all the allopaths have changed their mentality and ultimately that have gone to the surgical cases. Because they are considering this is a one-time disease, we will cure them, we will treat them with the surgery and go for free for everyone. And they are considering this thing also, the patient will not be tortured with the help of medicine for a long time. Whereas, though the medicine is much cheaper than the surgery, whereas we have seen this thing, so many complications of the surgery are there, but even then, they prefer surgery. No doubt in these days, we have seen this thing, they have some more modern advancedness in the surgery, where they have gone for the otherwise range of the different type of range are also there to cure the surgical cases. So ultimately, they prefer this thing. But still, in homeopathy, we have so many diseases where there is no need of knife. And out of this, I'm just starting that particular disease, which is very common from the childhood onward. Every child, most probably, we have seen in India particularly, this type of particular disease of the throat infection, which generally called as tonsillitis, the inflammation of the tonsils. This particular disease is basically where the patient having the cough, difficulty in swallowing, or sometimes very fever, or sometimes very pus formation is there. So like that way, there are a number of symptoms are there from where we will consider this thing, this may be due to the tonsillitis, due to the inflammation of the tonsils, where person catches the cold and ultimately the infection in the throat is there. So for this, no doubt we have so many medicines. The topmost medicine which we consider in homeopathy, that is the Britacar. Britacar is a particular medicine where there is a tendency to enlargement of the glands, where the glands are indurated. There is hardness of the glands are there. Person catches cold, generally the child catches the cold, there is suppuration in the tonsils, or sometimes stitches are also there, stitching pain is there. So this particular condition, when that is there, we can consider the Britacar. But for Britacar, I can give you one more tip. You just see the tonsils and see the color of the tonsils. If there is no infection is there, no redness is there, nothing is there like inflammatory symptom. Simply the tonsil having the buccal cavity color. That means as per the routine color of the throat, then you can think of Britacar. But when inflammation starts, generally the next symptom starts, that is the redness of the throat, redness of the tonsils. And majority of the symptom, when there is redness in the throat, there is swelling of the tonsils, plus there is heat, burning, or moreover, all the character of the inflammation are there. So we can think of the first medicine of the inflammation, that is belladonna. So after Brita, belladonna is the topmost medicine for that condition. Next medicine, which I am just talking about this thing, there might be suppuration, fever is there, person gets fever with chill or without chill. So in that condition, when there is swelling, difficult sensation as if the plug is there in the throat. So in that condition, we can think of hip ulcer. When you will see the tonsils, the color of the tonsil, that is also calling you. And plus, if there is pus is there on the tonsils, white spots are there on the tonsillitis, then you can think of hip ulcer. Next medicine, which is very important medicine for the tonsillitis, that is lachesis. Lachesis, we have a specific medicine for particularly when the tonsils are involved of the left side. And particularly if we see the color, as I am giving importance to the color, first the purple color, the simple normal color, pinkish color, that is the Brita, reddish color, then belladonna, and if that color is purplish, bluish, then you can think of lachesis. And other symptoms of the lachesis are also there, that is particularly constriction feeling in the throat. When person is sensitive to throat and not touch anything on the throat. So that is the lachesis. So next medicine, which is more important, where the person gets enlargement of the tonsil, there is ulceration on the tonsil, plus constant desire to swallow. Killer symptom of the next medicine, that is mercurius, which is the excessive salivation. Even the color of the tonsil also calling for mercurius, bluish red. That is the mercurius color. So I am giving you more importance on the color particularly because that is the only sign which we can see on the tonsil by looking the tonsil. If the pinkish color is there, Brita, reddish is there, belladonna, bluish is there, lachesis, and bluish red is there, then you can think of mercurius. And along with this, the mursal having its own symptom, excessive salivation in the mouth. So that is important. Next medicine which we have are the tonsillitis, that is Phytolacca berry. This is also again one of the best medicine of right side tonsils, where tonsil looks like cherry color, dark red color. So that is again the color of the, you can give importance to the color by looking the tonsil. There is shooting pain that goes to the right ear. Particularly when there is shooting pain goes to ear, we can think of Phytolacca. Patient cannot swallow, that there is hotness is there, plus there is burning pain and difficulty in swallowing. These are the common medicine which we generally use for the tonsillitis. But one more medicine is there, which is more important, that is particularly when this tonsil problem comes, subside, again comes. That means periodicity is there, periodical conditions are there. Again and again the tonsils inflame. Generally, mother or the mother of the child generally comes this thing कि हर 15 दिन बाद patient हो रही है problem. So like that way, repeated problem are there. So you can think of to cure that case, Felicia is a medicine for that. Felicia and one more particular medicine, that is Tuja, which we can give condition where glandular problems are there. So we can think of Tuja as a psychotic medicine also. So these medicines are there. So as a whole, the most common disease in India and generally coming to the homeopaths, that is the disease of the child, particularly tonsillitis. And for this problem, take it granted, all these medicines are very effective and you can cure that case. But one thing here, one warning is there. Generally, what we have seen or what we have learned in the surgical cases, when repetition of the tonsillitis reoccur twice a week, so frequently there, then you can have taken the help of the surgeon and send the child to the surgeon for surgery also. That is the condition which basically harm the child and that check the development of the child. So that is the problem. So we don't want to basically make the child in future as a complicated case. So for that purpose, we can request the parents for surgical condition also. But before that, all these medicines are very good medicine where periodically conditions are very less or weekly or you can say after fortnight or monthly, like that complications are there. Then you can give homeopathic medicine. Be sure, take it granted, all these medicines, particularly Brighta, Pelarona, they are the more effective at even first stage. Even one more medicine I can add, that is the biochemic medicine, Calimure, which you can add whenever you are giving even homeopathic medicine. Because Calimure is the second stage inflammatory medicine and also help to the infection of the tonsils. And not tonsils, even of the buccal cavity, throat. So in that condition, Calimure as a additional medicine you can add. I'm not saying this thing that you mix the Calimure with Belladonna or Vitaca, but my point is this, that you can take or advise to the patient to take the Calimure instead of giving any combination of biochemical medicine. This is about the first complication, which is called surgical disease, but I am saying this is not at all surgical, can be cured with the homeopathic medicine. Next we see is nasal polyp. So what we have seen, not in the child, even in the young adults also, even adolescent age people, where they have the complication, frequent sneezing, recurrence of the nostril problems, frequent coryza, there is blockage of the nose, like that way, excessive coryza, frequent sneezing, all these are the common problems. And when we will see the nose, we will see there is inflammation on the septum of the nose, that is the nasal polyp. Polyp generally occurs when the patient having the complication like frequent sneezing. And even I have seen this type of polyp, which becomes so enlarged, comes out of nose. So this is the worst condition of the person, where when he cannot tolerate this thing, the tonsil, swelling of the tonsil, nasal polyp that comes out of the nose. So for these are conditions, we have the medicine. The first medicine in homeopathy, that is lamina minor. Especially this medicine you can use when there is nasal obstructions are there, frequent sneezing is there, excessive catra is there, running nose is there, even sometimes blockage of nose. Polyp swells in the wet weather. This is a particular condition. Wet weather means rainy weather, or particularly we have seen a occurring problem yearly, particularly during the winter weather. So first medicine is the lamina minor. Next medicine, which is more important in homeopathy, which is very important, that is the teucrium. Teucrium, the medicine which we have seen for the nasal polyp with loss of sense of smell. This is a peculiar symptom where patient says, due to the polyp or due to the blockage of nose, I cannot even having the smell of anything. This is a particular condition. So there is crawling in the nostril, patient having the irritation in the nose, there is with the lacrimation and sneezing, all these things are there. So that condition we can think of teucrium. Next best medicine is a constitutional medicine that is called calculi. Calculi are two constitutional medicine for the child, where we have seen the healthy child particularly having the belly, dominant belly, but for the polyp with loss of olfaction, swelling at the root of nose. So this is particular condition. Sometimes doctor say this is the adenoids. So nasal polyp or adenoid. Basically, we have the same medicine, calculi. So for the when there is swelling at the root of nose, take cold at every change of weather. Particularly, patient is sensitive whenever patient goes to cold, gets cold. This is a very important symptom. For the calculi, sensitive to cold. Offensiveness, offensive odor in the nose with offensive yellow discharge. This is peculiar condition, particularly when there is lingering the polyps. After some time, the smell of from the nose that comes, and patient himself also feels there is discharge and that is offensive in condition. So this is the medicine, calculi, which you can use as a constitutional medicine also. Next, more important medicine, which I am just telling you, that is frequently used by our homeopaths, that is sanguinaria knit. Sanguinaria knit particularly is called as a specific medicine for the nasal polyp. Nose feel obstructed, enlarged, terminate at the beginning of the hypertrophic process. So beginning, that means at the near the tip of the nose, near the opening of the nose, we can think this thing. Post-nasal secretions are there. That is no doubt, post-nasal secretions are, we have seen, especially medicines are there, calculi is there, and so many other medicines are there. But particularly in case of when the polyps are there, you can think of sanguinaria knit. This particular, there is rawness and soreness in the posterior senses. Feeling of something, irritation in the nose, that is the physical point for sanguinaria. But as a whole, sanguinaria is good medicine for the polyp. Next medicine is calculi. Just now I have told you this thing. There is post-nasal catra. Particularly in calculi, one peculiar symptom is there, nasal discharge, thick, ropey, sticky, and greenish yellow. This is the peculiar condition. Post-nasal catra is there, plus secretion, discharge is thick, coming like a sting. So that is the most important point. And there is obstruction in the nose due to the polyps. All the points are important. Next disease, which is more important whenever there is acute pain in the abdomen. We have acute pain in the abdomen from so many conditions. but peculiar pain, particularly in the right side lower abdomen, when the right side lower abdomen and particular space is particularly that is mid of the line drawn from the clavicle to umbilicus, sorry, umbilical region, we have one line draw, and mid of that, if we will touch, there is swelling that is called appendicitis. Appendicitis is basically disease known as inflammation of the appendix. This particular condition, as a symptom I have told you this thing, right side, lower abdomen, so itself indicating one more medicine, specific medicine which come to your mind, right-sided medicine, lower abdomen, particularly pain in the abdomen, that is lycopodium. You can think of lycopodium immediately, but before lycopodium, there are few medicines which we can think. Particularly, Brownia is a medicine, no doubt Brownia is a right-sided medicine, but peculiarity of Brownia is the least movement average. Patient cannot move because as soon as he moves, there is pain. Burning pain, stitching, burst from pressure, from least motion. This is the particular symptom of Brownia. Acute pain in the abdominal wall. All the abdominal wall is tenderness here. Wherever you touch, there is pain. So Brownia is the one of the best medicine, but specifically due to the word of inflammation, as we use appendicitis, there is inflammation. So belladonna also comes there. Belladonna is medicine for the inflammation, first stage of inflammation, redness, swelling, heat, pain, all words are there in the part of abdomen. And very pain or pain is worse by a pressure and jar. Slight jerk is there, the pain is there. So that is the belladonna. Peculiar condition for belladonna, that is particularly from jar, jerk. Extreme sensitiveness due to the swelling. Specific medicine for this condition, one more medicine, that is thuja. Thuja basically are the medicine for the glands, where the tendency of the induration of the glands are there. We have the medicine, this thuja is medicine for the tonsillitis also, whereas we can give for appendicitis also. So thuja we can consider. Lycopodium, I have told you this thing. According to the symptomology, lycopodium, right-sided, lower abdomen pain is there. We can think of lycopodium. Very good medicine. Plus, along with the lycopodium, other symptoms are there, gas formation and full bloated abdomen. Next medicine for the swelling of the right groin, that is epismel. Epismel, we can think of as a good medicine for appendicitis, but the peculiarity of the apis is the extremely tenderness, sore, bruise, or pressure when there is sneezing. This is the peculiar condition. Nasal is a medicine for the appendicitis, better when lying on back, stabbing pain with chilliness, boring pain in the right groin, intestine feel bruised when lying on right side or as if they fall to side on which one is lying. This is the peculiar condition of the Mercor. Mercor is also medicine for this appendicitis, cutting colic below navel, particularly right side. Phosphorus is a special medicine for this condition. Appendicitis generally people never use, but I have seen particular condition. There is large yellow spot on the abdomen. That particular condition which causes for the phosphorus. Otherwise, inflammatory conditions are there. So there is redness, there is heat, all the things are there. But in case of phosphorus, abdomen feels cold, plus there is large yellow spots on the abdomen. This is a particular condition, also. This particular medicine, Aristotelis, which generally homeopaths use as one of the specific medicine for appendicitis, even without any symptom. Whenever they think of appendicitis, they can use this medicine, or they are using this medicine and getting the result also. I have also used this medicine in so many conditions, so many appendicitis patients where no symptom is there. But one thing is there, as soon as the pain is over, just go for the indicating symptoms and prescribe the indicated medicine. So, but we have seen 4, 5, not 4, 5, even 9, 10 medicines are there, appendicitis, where generally allopaths say you have to go for surgery, immediate surgery there, this can burst, this can, and so many things can happen. So ultimately, don't worry, we have the homeopathic medicine, and homeopathy works like anything. Within no time, I can say, you will get the result. As soon as you will give this Aristotelis, immediately patient say there is no pain. First medicine which you can give without any symptom for appendicitis, particularly, that is the where the pain in the idiopathic region is there, and you think this is appendicitis. Aristotelis is a specific medicine. Next disease, which is again more important, though this particular disease, generally people are thinking, if for this we have not good medicines, or we cannot treat this particular disease, that is cholelithiasis, stone in the gallbladder. Particularly stone in gallbladder, whenever we heard from the patients, because mostly patients coming with the reports, or they are saying, I have the ultrasound and the doctor says there is stones are in the gallbladder. Is there any homeopathy medicine in homeopathy? And we generally say, sorry, because what the reason, mostly homeopaths are not having the confidence in this condition. And that's why they are just refusing to a patient for just removing the gallstone from the gallbladder. So for this purpose, I am saying this thing, okay, you must have confidence in homeopathy medicine, but the thing is this, you need some time. Give some time to the patient and you will get the result also. So for this condition, though we have a specific medicine like Chalcedonium, Hydrastis, or Clostridium, all these three medicines are mentioned in the boric also. Even in the all the medicine, first line, even first word is gallstone. So we can use this medicine. I have seen the result of 1 or 2 medicine even combined also. Not combined, mixing them, but using as a Chalcedonium plus mother tincture of Hydrastis, or Chalcedonium as a mother tincture. So like that way, few mother tinctures are also very good or effective. So Clostridium is the first medicine which he mentioned in even the specific as a gallstone colic, specific medicine. Particularly, if we see the character of the stones. The stones are of mostly of the 3 types. Either they are bile collected there, or fatty collected there, or bile and fat is there. So ultimately, when this bile is involved, are the formation of the stone. So Clostridium is a specific medicine for that condition, and you can use this medicine which will dissolve the bile. Specific medicine, no doubt. To liquefy the bile, we have one more medicine, is serum. Sorry. Next medicine, I am coming to that point. Filturi. Filturi is a specific medicine for that condition where bile is collected, become thick, and you want to liquefy that. Filturi is a specific medicine. But otherwise, for fat, bile and fat, and stone formation is this, due to this thing, you can think of Clostridium. Clostridium, generally people are using in the 3x form also. So you can use it in the 3x also, but result is there in the third equivalent. Then Chalidonium is the specific medicine, as I told you, this thing, Chalidonium, Clostridium, and Hydroxyl. These are the three specific medicines which are mentioned in the boric. Where first word is there, Gallstone. Then China is another medicine which have a specific symptom. In case of gallstone or gall colic, heat in abdomen as if hot water is running down. This is the peculiar condition. And this type of feeling is there, no doubt distensionness is there, China gas formation is there. You can consider all the general symptoms, but China covers the good condition and give the relief to the patient. Cardus is another medicine which generally doctors use as a mother tincture, but good medicine in potency also. Pain in the region of the liver, gallstone with enlarged liver, and particularly gallbladder with painful tenderness. Swelling of gallbladder, cholecystitis. Generally, patients are coming with the acute condition, cholecystitis with cholelithiasis. This is the combination word is used by the ultrasound person. So, in that condition, we can think of cardiovas also. So, history, which I have told you, this thing, a very good medicine for the gallstone, Filturi and Clostridium. Again, I am telling you, these are the two specific medicines where head and bite combined is there in the formation of stone. You can use Clostridium, where bite is only there, thickening of the bite is there, and you want to liquefy that, you want to dissolve that bile and make the stone as a absorb. So that Filturi is the specific medicine, and both these medicines are used by homeopathy in 3x form also. So you can use it as a 3x or 30 up to you. Hydroxyl, mother tincture plus 30 pencil. Both ways you can use. But in case of acute formation, acute condition, particularly severe pain is there, sometimes we will give the hydroxyl in low frequency, particularly for acute problem, and after that we can give this hydroxyl 30 frequency later on for completing the case. So in case of hydroxyl, we have a specific symptom, cutting pain from liver to right scapula, worse lying on back or right side. Particularly pain goes to back and goes to upside, that is the Chalidonium. That is a specific symptom. But in case of the right scapula pain is there, we can think of hydroxyl also. Chalidonium, peculiar word is mentioned in the particularly boric. Pain goes to back and upward to the lower angle of scapula. That is the peculiar word used by the boric, and when that word is there, which is very common for the gallstone, think of Chalidonium and one of the best medicine. But since pain in the right scapula is there, cutting pain is there, so in that condition, I am just using the both medicine as a Chalidonium, reticulency plus hydroxyl in acute condition in mother tincture. Very good medicine are there. Then one more medicine is there, which is for the gallstone as a right-sided medicine, that is lycopodium. Lycopodium, since right-sided medicine is there, gas of the abdomen is there, abdomen is full, bloated, colic immediately after eating. These are the common symptoms of the lycopodium, and no doubt one specific more symptom which you can consider whenever if the pain is in the 4 p.m. think of lycopodium. Next surgical disease is hernia. Before hernia, I am just going to another stone condition, renal colic, that is renal calculi. Renal calculi, as we have seen this thing, there is formation of stone in the gallbladder, that is the gall colic. Same way renal colic is there, and there is stone in the bile and kidney, particularly renal region. And this type of the stones are generally of the calcium and oxalates. That's why we are generally avoiding the patient not to eat calcium, more calcium, plus or avoid the oxalate items like tomato and other things. So these stones are of the formation of oxalate and calcium particularly. And for this condition, though specific medicines are there, like lycopodium and berberis. One is for the right side and other is for the left side. Every physician knows for this medicine. But for peculiar condition of berberis is that there is pain radiating from the kidney to bladder. This is the particular condition. In case of berberis, one specific symptom is mentioned. The pain starts from the kidney and that goes downward to the bladder. That is the peculiar condition. Or if that is of the left side, surely you can give berberis. Even in the right side also, we can think. But for the right side stone, renal colic, we have a lycopodium. But before going to lycopodium, we have a specific medicine called in homeopathy as a stone breaker medicine. Stone breaking remedy in homeopathy, particularly hydrangea is there. Hydrangea is a very good medicine which breaks the stone, and ultimately stone comes easily out of kidney, or even there is no chance of any constriction, particularly in the ureter or somewhere else. So this is a specific condition. Stonebreaker medicine, renal colic with bloody urine, it particularly act on the ureter also, having the particular condition burning in urethra and frequent desire to urinate. This is a peculiar condition of hydrangea. Then right side stone is there, lycopodium, pain in the back before urination, CA after flow, polyuria excessive, especially at night, red sediment in the urine. This particular red sediment are there mentioned in the lycopodium as a red sediment. And white sediments are mentioned in another medicine, that is sarsaparilla. So we can see the urine, and if the sands are settled in the lower part of the any jar or any bottle or anywhere where the urine is collected, then you can see if the redness is there, think of lycopodium. If these RE sediments are white, we can think of sarsaparilla. So these type of the medicines are there. But conium as one of the best medicine for the renal colic. Renal symptoms more pronounced in right side. Stone in bladder with spore pain in ureter. Particularly stone in bladder. No doubt for bladder we have a specific medicine, sarsaparilla. But osimum can also use it as a medicine for the tenesmus in the bladder. Osimum can is a next medicine. Specific medicine, just now I have told you the thing, when the stone in the bladder is there, we can think of sarsaparilla, deficiency, and we can give this medicine, having a good results. Severe pain at the conclusion of the urination. Bladder distended and death. Tenesmus of the bladder. So almost because the stone is in the bladder, that's why all the complaints are of the bladder. Sarsaparilla is the next another medicine which is very effective. Coming to the another location, when we have seen ultrasound and they report the stone comes down and goes settled at the right ureter or left ureter. So in that condition, when the stone in the left ureter has a specific medicine, tobacco is the medicine for that condition. When stone in the ureter, particularly in the left side, you can think of tobacco. Then if the stone in the right side, particularly right-sided renal colic extending the genitalia and legs with dribbling urine, irritability bladder of the spasmodic sphincter, Nux is the medicine, painful and ineffectual urging to urinate. This is the Nux symptom is there. One more medicine which I am just telling you, peculiar with one peculiar condition, which you may not have noticed. When there is severe pain in the kidney region and there is no relief by hot fermentation. You have given the homeopathy medicine also, hot fermentation you have given, even then, or otherwise as hot fermentation. Generally, patients are taking hot fermentation, but no relief is there. I have seen this thing in that condition. We just give fermentation alternately hot and cold. Then patient gets immediate relief. One time hot fermentation, then the other a few minutes cold fermentation. So like that way, alternate that. And specific medicine, calcarea carb 200 I have used. Very good result is there within no time relief. In all type of emergency of the renal colic particularly, this particular emergency is there when the pain in the kidney region and not relieved even after getting the hot fermentation. Then give hot and cold fermentation alternately and along with calcarea carb 200, sure result is there. That is a good medicine for renal colic. Another one more medicine which he mentioned in the colic particularly, Ruta. Very constant urging to urinate. Bladder feels full. Pressure in the neck of bladder after urinating. Painful closure. So Ruta 30 you can give. This is the specific medicine. So for renal colic and gallbladder, no doubt, mostly people are coming to homeopaths with renal colic, or they are the belief that we can move the stone through urethra. Renal colic, renal stone can be removed, but gallstone cannot be removed. Gallstone can be dissolved, and that can not easily dissolved, no doubt, but can be dissolved with some time. So we have the certain medicine. You can try also then. So next particular condition is there, which is very common and good results are there. That is the hemorrhoids. Generally, in case of hemorrhoids, this is the inflammation of the hemorrhoidal vein, swelling of the hemorrhoids are there, and along with that, peculiar condition, bleeding is there. Hemorrhoidal with sharp shooting pain up to the back, blind and bleeding, purple, painful external burst, standing and walking. Rectum feels full and spastic. Burning in the anus with chill up and down. This is the condition where we have a specific medicine. In all the homeopathic medicine, this medicine is mentioned for hemorrhoid, exclusive. This is not for the hemorrhoid, even our blind pipes, where we have seen some bland swelling on the outside the rectum is there. No blood is there. We can subside that condition also with the help of the exclusive. Aloe in other medicine, where hemorrhoid protrudes and looks like bunches of grapes. Basically, when any hemorrhoid protrudes out of the anus, that is in the one side or in the all the three sides. They are three or in one. So when they are three, they are like a bunch of grapes. Bunch of grapes, when that looks like that, we can think of aloes. Or when there is one, we can think of even exclusive. Another medicine for hemorrhoid, one specific symptom, that is peculiar pricking sensation. sensation of sharp sticking in the rectum. Patient just generally say this thing, suiyan si chubhti hain. So that is the peculiar feeling, sticking pain in the rectum. And along with this sensation of constriction, you can think of colonsonia. Colonsonia, specific medicine. No doubt, when there are hemorrhoids are bleeding, they are bleed easily. After stool, they are drop by drop. Blood comes out of the rectum. There is pain, burning in the rectum, and this particular pain remains for hours together. As Alan says, pain remains after passing stool for hours together. घंटा 2 घंटे नहीं है, इवन कई घंटे तक रहती है like this way. This is the common symptom. So we can think of nitric acid. Very good medicine for this condition. So as we have already discussed about this, exclusive as a blind medicine for the hemorrhoids. Blind hemorrhoids are there. Same way nuts is also there. When there is no blood is there, but along with the nuts vomica, peculiar condition that is the ineffectual urging to pass through. Very painful after drastic drugging. Constant uneasiness in the rectum. Patient always feels uneasiness. Something feeling in the rectum is there. Patient cannot sit properly even. Changing places frequently. Itching with constriction in the rectum. So that is the common symptom of the nux vomica. Otherwise, when there is history of constipation is there, we can think of nux vomica, and nux is not medicine for constipation. Even blind hemorrhoid caused by constipation is the nux. Next medicine, muriatic acid, which generally homeopaths never use, or because as it is mentioned, when the hemorrhoid during pregnancy is there. No doubt, in pregnancy, if there is hemorrhoid, we can think of muriatic acid. But otherwise also, hemorrhoid can be, and for hemorrhoid, muriatic acid can be used, particular condition, most sensitive to all touch. Even the sheet of the toilet paper causes pain. So whenever we are washing the anus after passing stool, touching the anus, there is pain. So that is the muriatic acid. Sensitiveness is there. So muriatic acid is another best medicine for hypersensitivity of the last part of the rectum. Then another medicine which is more important, mentioned in the particularly boric penia, hemorrhoid large and ulcerated. So here we have not word this thing ulcerated. How we can say? But now in detail, what I have seen, this is good for the patient also with the understanding. They are taking the pictures and coming to you. And they are showing the picture of the hemorrhoids. There is ultimately some judgments and any patient bolta hai. So like that way he is doing an angle. So they are showing the ulceration of the anus and perineum. So there is burning in the anus and with internal chilliness. So we can think of penia is a medicine when particularly ulcerations are there. This is the one curious condition regarding the genital warts. So patients are feeling shy, they are not telling to the doctors about these warts, but sometimes patient comes and they say, hey, I have the warts on the genitalia and we have a peculiar medicine also. For that condition, we can use Aureumur specific medicine, genitalia warts and males, ulcer of foreskin, warts around, then ulcer on gland. Particular condition, Aureumur, generally doctors are using in 3 years. Then another medicine, Mercor, genital warts in male. Shankar assumed regulatory appearance. So basically, there is ultimately some ulcerations are there, and warts is there, hardness is there. So this is the soreness of the gland penis, feeling hot also. So mercury we can use. Specific medicine for the warts. As a psychosis patient, Medrina is a good medicine, but not genital warts in male, but female also. Genital warts in female, Medrina is a medicine, particularly on os, uterus ulcerated. Sensitive spots near os and uterus. Psychotic warts on genitalia, particularly Medrina is the best medicine for that condition. Nitric acid. No doubt, nitric acid having the peculiar symptom, there is itching pain, burning pain, and warts on the genitalia, particularly male genitalia, redness and burning in gland and beneath the pupil, that is the nitric acid symptom, more important. One more important condition I am just telling you, in case of nitric acid, there are sometimes cracks on the pupil of the penis also. Because when the person is moving the or bringing the backward skin, the ulcer or not ulcer or that skin tears, there becomes burning sensation, itching is there on the foreskin. So that is the nitric acid. Then wrote out psychotic medicine, which is also good medicine for warts, not on the genital warts, but warts on any or every part of the body, particularly cauliflower warts. That is the future. Cauliflower like expensive, bleeding easily, that is future. Warty growth on the vulva and perineum in case of female. Renal warts in female. Experiences on pupil and glands in case of male. So in that way, future is a almost specific medicine. No doubt, majority of the our homeopathists are also using this medicine as a first medicine for warts. Because they, whenever they listen about the warts, they think of future. We only heard this thing even in the student life also. The future is one of the best medicine for warts. But future covers cauliflower-like warts. I am just giving you a differential point for your knowledge. Pendulum-shaped warts are also there. Flat warts are also there. So in case of pendulum or pedunculated word is used in the bore, that is in the causticum. In causticum, the word is used pedunculated warts. Warts looks like a pendulum. They are smooth, round from the upper part of the warts. Whereas they are looks like cauliflower, then you can think of future. When they are pointed, sharp pointed, then nitric acid is a medicine. When they are flat, nitric acid is a medicine. So these are the some differential points for in case of warts. So nitric acid, no doubt specific medicines are the medicines are for warts in general, not for the genital even. Causticum, future, nitric acid, and two more medicines are there, which are very common mentioned in the books, particularly on the palmar side, natamur, on the dorsum side, Darkemara, are the warts, that is the specific medicine which are mentioned in the books. So we can have a medicine for warts or general condition also. Another more common disease, which is uterine fibroids. Indeed, particularly maximum people, particularly women, at the age of menopause or near the menopause or when they are touching the menopause, generally coming with frequent bleeding and allopathy for the ultrasound, and they are saying there are fibroids, and due to that, this may be the reason due to the excessive bleeding or perfusion. It might be otherwise due to menopause, but generally we are seeing majority of people particular ladies after 40, they have the complaints of fibroids. And for fibroids, again, homeopathy medicines are very good medicine, particularly Aurum natrum. I am using this medicine blindly. Don't mind this thing. Sometimes I am using the specific word because with the 45-year experience, when I see this thing, the reality there. So in that condition, sometimes we never think of the symptoms, we think of the results only. So in that condition, we use this particular medicine, Aurum natrum, as a blind medicine for particularly fibroid cases. Particularly, Werner says it has more power over uterine tumor than any other remedy. This is a particular line which I read in my early student life, and till date I am keeping in mind, and I am using Aurum natrum as a one of the specific medicine for uterine fibroid. Induration of the one part and softening of another, predominantly a syphilitic remedy, carcinoma on a syphilitic cases, have a pronounced effect on a female organ. Best medicine, particularly in case of uterine fibroid with profuse bleeding. Uterine fibroid with beating down sensation, uterine fibroid with bleeding. When the profuse bleeding is there, you can use of this particular medicine, tetanus. I am using this medicine in mother tincture, getting results when particularly bleeding are profuse, and generally ladies are coming with profuse bleeding due to fibroids. So in that condition, to check the bleeding, where we are generally using hemorrhoids, phosphorus, and other so medicines are there, but you can use as a specific medicine, tetanus cure, mother tincture, for bleeding from the fibroid. Next medicine, rolled out, he also gained bleeding for fibroids, Savina is there, but in case of Savina itself having particular symptom, pain from up downward, from sacrum to pube. This is a particular condition. When there is pain in the sacrum to pubis, pain comes from back to upward, and above to downward, along with the menses or dysmenorrhea is there. There is fibroid, history of fibroid, or having the patient having the fibroid, you can think of Savina as a running medicine. You can see high transfers. Again, this particular medicine, I have heard from some doctors that whenever there is some growths are in the body, extra growths are there, we not use only puja, but even sometimes we use the hydrostasis also, and that gives good results. But the peculiarity of the hydrostasis is fibroids, especially at the age of menopause, which I have just now I have told you the same. During the menopause time or before menopause or at the onset of menopause, generally ladies are coming to us having the history of fibroid, or they are coming with the history of only bleeding. But when they go for ultrasound, doctor says, report says you have ultrasound of uterine fibroid. So this particular medicine here I'm using fibroid especially at the age of menopause. Hot body discharge from the uterus, menorrhagia and metrorrhagia with fibroid. So hydrostasis is one of the specific medicines. Carcinosin. No doubt carcinosin, we are using the medicine for cancer. We can use the medicine for cancer also, but fibroid also. Because fibroid and tumor both can be cured with the carcinosin. Menses frequent too early, uterine bleeding after sexual intercourse, and history of masturbation that is there in case of females, particularly uterine fibroid is there. So carcinosin can be used as a medicine. This medicine, particularly astragalus, is one of the specific medicine or uterine fibroid with bleeding dark hemorrhage. Hypertrophy of uterus. Hypertrophy of uterus is the one word where in the modern days, doctors are generally using bulky uterus. Subinvolution, flabby condition of the uterus. Uterus is drawn into a knot. That means feeling of beating down sensation. So that all things are there indicating the bulky uterus syndrome. Uterus enlarged, and along with that, fibroid is there. Stelico is the medicine for that condition. Now, another medicine, other disease particularly, which is very common in girls, ovarian cyst. Indeed, a commonly word used by PCOD, PCOS. Like that, with these words are used by them. But ultimately, ovarian cyst, if that is there, maybe on right side or maybe left side, we have the specific medicine. No doubt, first medicine for cyst is the epismel. Not for ovarian cyst. Any type of cyst, if anywhere in the body is there, we can think of epismel. So epismel is not for the ovarian cyst only, even cyst on any part of the body. Along with peculiar symptoms, coldness and stinging pain, ovarian tumors with stinging pain, ovary numb and congested with suppressed menses, pain in ovary worse after sexual intercourse. That is the peculiarity of the apis. Lycopodium is another medicine for the ovarian cyst, ovarian tumor, particularly when cutting pain in the right to left ovary. Dysmenorrhea, violent with fainting. Lachesis. Lachesis is particularly for the left side ovarian cyst. Left ovary swollen, dilated, painful, must lift cover because sensitivity is there. Ovarian and uterine fibers painful are relieved by the flow. This is the common symptom of lachesis because in lachesis all the complaints are aggravated by the check, discharge, and relieved by flow. Another medicine for ovarian cyst is the platina. Though the peculiarity of the platina is one of the sensitivity of the genitalia. Sensitiveness of genitalia, itching, tingling, and crawling. Even in the book's word is mentioned there, the patient faintness after touch to the genitalia. So much sensitiveness is there. Ovary sensitive with burning pain. And if there is cyst in the right or left ovary, you can think of platina. So with all the problems, we have number of surgical cases which are mostly common coming to us. But I have left, you might have seen, you might have heard the word hernia. Regarding hernia and hydrocephalus. But I am just telling you, no doubt this is also so-called disease. But I think don't waste time on these diseases because these diseases are due to the posture. Posture effects are there. There is heaviness in the abdomen, there is distension in the abdomen, or due to the intra-abdominal pressure, hernia takes place, or intra-abdominal pressure which we cannot check because constipation we cannot control in that way to every person. Patient is laughing, patient is sneezing, patient having the intra-abdominal pressure, gas formation, distension is there. So many conditions are there which we cannot check or they are difficult to check. So ultimately, these are the things which basically keep pressure on the hernia every day. And moreover, the muscle of the inguinal canal become weak. So weak that they are unable to tone up. We cannot tone up in a day or two. And moreover, when hernia is protruded like anything, so in that condition, sometimes the protrusion is so much very painful, strangulated hernia. Sometimes they are not coming in reverse, or some may be coming to back, but at the night time when he on the rest. So with this condition, it is difficult to cure such type of difficult disease. So hernia and particularly hydrosis, I will say difficult to cure with homeopathy medicine. So if you are advisable, with my experience, I am saying let them go to the surgeon, take the help of the surgeon, and we can go for that way also. But just other disease which we have now discussed, they can be, not can be, surely we can think of homeopathic treatment. We can treat with the homeopathic medicine. With this, I am just giving you one more particular conclusion, completing your this particular program for 11 years, and on 12th we are starting our next year. So congratulations to Dr. Pramila for this total program. Very nice program done by all of you. Thanks to everybody. Thank you very much.
थैंक यू सर जी। सर जी हमारे 11 साल हो गए हैं पूरे, और 12वें साल में हम डेयर छोटा सा भी है, बहुत बड़ा नहीं है, लेकिन हम बड़े हो रहे हैं, धीरे 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 आगे बढ़ रहे हैं।
बड़े तो होना ही है।
हाँ जी, हो रहे हैं।
आगे आने वाला टाइम जो है ना 13 ऑनवर्ड, that will come for you.
थैंक यू सर। टीनेज में जाने वाले हैं 1 साल बाद।
थैंक यू वेरी मच।
थैंक यू सर। कोई किसी डॉक्टर का सवाल हो तो प्लीज, किसी डॉक्टर का कोई सवाल हो तो प्लीज।
हेलो, हाँ जी
हेलो,
डॉक्टर प्रोमिला। हाँ जी डॉक्टर
हाँ जी,
प्रोमिला, डॉक्टर राजीव जैन है।
हाँ जी, आप अपना वीडियो ऑन कीजिए। किसी को भी कुछ पूछना है प्लीज वीडियो ऑन कीजिए।
नहीं, मैंने कुछ पूछना नहीं है, बल्कि मेरे को एक थैंक्स करना सर का और आपका। सर को इतने सालों से देख रहे हैं ना, ऐसा लगता है वापस हम आए, ऐसा लग रहा था कॉलेज में वापस बैठ गए हैं क्लास में। तो बस वो एक बहुत अच्छी फीलिंग थी, बहुत अच्छी फीलिंग थी। थैंक यू सो मच, थैंक यू।
थैंक यू राजीव, थैंक यू। किसी और का कोई सवाल हो प्लीज वीडियो ऑन कीजिए और सामने आइए।
मैम डॉक्टर रोली है।